Hologic primarily is a company that focuses on medical device. And as a medical device company, what we know is that what you can measure, you can improve. But to be able to measure, you need data. Right now, globally, the current status is that there is a paucity or an absence of data around women's health in most countries, and particularly in the poorest and the most marginalised. I would also argue there's a paucity of data even in first world countries. That's why the Global Women's Health Index came into being. We started the concept in 2019, so well before COVID. We partnered with the Gallup World Poll, which is a globally revered data analytic and collection agency, and we embedded a series of questions in their annual World Poll. Those questions were designed to elicit information from women in their own voice, at a local level, and in their local language. So far to date, we've had 2 years of the survey data. The third year is about to be released in October of this year. So we collect in 1 year, say 2019, and we produce the report in 2020. This year's report will be speaking to last year's data collection. The importance of the data, as I've mentioned, it's from women themselves, interviewed in their own language, around a common set of 10 questions. And those questions are binary. The answer is either yes or no. So there's no room for interpretation in their response. One question is, in the past 12 months, have you seen a medical professional? Yes or no? So it's very easy for us, year after year after year, to compare the results of each year and to derive an understanding of what each country's overall response from women about their health is. That's the power of the data through the Global Women's Health Index. We are invested in continuing this survey for at least the next 8 years. And as we build year on year, we will be able to correlate and share that data with governments around the world. That data is empirical. there's no way of fudging or hiding behind the information that it's showing to each country. On the right hand or left hand, no, you're right. On the right hand side of the screen, you will see a heat map. The darker colours on the map show you the higher or the lower score for those countries. Each question gets added together. Each country gets an average score. Globally, out of 100, the current score for women's health is 53 out of 100. The highest score is from Taiwan. The lowest score is from Afghanistan. And it's very interesting when you look at the rankings where individual countries lie. Now, these scores, or the overall score per country, provides us information around 5 key dimensions of health. Those dimensions, when taken individually or collectively, can help us predict from birth the woman's average life expectancy. So, for example, basic needs, which you see there, which is food and shelter. If a woman in a country scores low in that regard, it means that she doesn't have enough food to feed herself or her family. She doesn't have enough shelter to keep them safe. That type of information can be a direct predictor of life expectancy. When we put all of these things together, emotional health, individual's health, opinions of health and safety, basic needs, but most importantly, preventative care, we get a direct correlation in relation to life expectancy. This graph on this slide shows you life expectancy across the bottom and the average global or average score on the index per country. So you can see here for countries on the middle or the end, Japan for example, very high life expectancy and above the average, the median line, for the global index score. Versus on the other side of the graph, Afghanistan, low life expectancy and the lowest score globally. This is the type of data correlation that we can now pull together to be able to speak to World Health Organization, the United Nations, the EU Commissions, every member state of the EU, countries, governments, societies, individuals. We can have this conversation around data that cannot be misinterpreted. Now, there's a lot on this slide. I'll just very briefly touch to a couple of the points. On the far left-hand side, as you're looking at it, after the second year, what we could see is that the average scores in countries in the middle and upper income bracket basically remained the same year on year. However, the distance between lower and middle income and the upper income countries nearly doubled in 12 months. Post-COVID, not surprising, a lot of funding was directed in other places. But regardless, speaking to the poorest and the most marginalised, which perhaps is where our efforts can have the greatest impact in the medium to long term, that's where a lot of focus is certainly now being directed. In the middle, you can see the different countries and their ranking. At the top graph is the highest ranking countries, and in the bottom, the lowest ranking countries, according to last year's data. And on the right-hand side, you can see some interesting statistics which speak to different elements of the demographic of women that were surveyed. If I start at the bottom, you can see age of first pregnancy. For those women who had their first pregnancy at 18 years or younger, they had a lower score in that average country. So when we looked at the total country score and we looked at the age of the women being interviewed, we could see that those women that have their first pregnancy at 18 years or younger had a much lower score. This is another cut of the data which allows us by country to speak to governments and say, if we know that young women are suffering because they have a lack of awareness around either contraception or how to get good care during pregnancy, then we know that they are going to score lower, and your country will score lower on preventative and generally women's health. This is the overall ranking in the EU. On the left-hand side, you can see the correlating graphs for each individual country, ranking from highest to lowest. The Nordic countries are called out in blue for easy recognition. You can see at the very top the average score of 53 for the globe last year, and then the score for each individual country in descent. On the right-hand side is the heat map, which shows you again, the higher the score, the deeper the colour. And so the Nordics are scoring very high in many elements of the index, those 5 dimensions that I mentioned. However, there's one that stands out. And I'm going to take us through each of these dimensions individually, just so you can see and understand a little bit what sits behind the data. And I'm at 10 minutes, so I'm just going to speed up a little bit. So this is a correlation between the overall global score on the top, the dark blue colour, and the Nordics score on the bottom, the purple colour. And as you can see, the Nordics generally above the global average, which is fantastic. And congratulations to the governments of the Nordics for the strength that they show for women's health at this point in time. When we look at each of the individual dimensions of health, so for this one, opinions of health and safety, this speaks to whether or not women believe that they can access and have access to good health care. It also speaks to their awareness of their safety. Do they feel safe walking alone at night? Do they think that domestic violence is an issue in the area in which they live? The next is the basic needs dimension score, and this I've already spoken to. This is the ability to access food and shelter for their family. And again, the Nordics, you have a fantastic standard of living where everybody nearly is provided for in a way that they can respond, yes, I do have access to food and adequate shelter. The next is the individual health dimension score, which really speaks to, do you believe visiting a doctor is of benefit to you? Also speaks to pain. Did you experience pain in the previous 1 to 2 days prior to the survey being done? And we know that chronic pain is one of those things that can actively reduce a woman or a person's ability to interact with normal life. Emotional health speaks to worry, sadness, anger, or some form of negative emotion, which at the moment is almost an epidemic across the world, with a lot of people post-pandemic experiencing negative emotions. But again, the Nordics comes in very high relative to the overall global. Unfortunately, however, preventative health. So this is a question that says, in the past 12 months, did you get tested for any one of the 4 diseases which most impacts women's health? Cardiovascular disease, diabetes, cancer of any type, sexually transmitted infections and diseases. Why do we include the latter? Because the latter can most materially impact a woman's ability to reproduce. So it's very important for society in general that we understand whether or not women understand how to be tested and the need for being tested for sexually transmitted diseases and infections. When we look at that score, 19 out of 100 globally, it's extraordinarily low. And then for a region like the Nordics to have only a score of 22 out of 100, it speaks to the need for us to delve deeper into why it is that women don't know that there is preventative support or care out there, why women don't want to engage, and why governments, perhaps, and other community services don't do more to improve or enhance the awareness. Now, preventative care, when we look at the Nordics, these are some of the statistics for each of those 4 conditions that I just mentioned. From a blood pressure perspective, it's a 15-second test. You go to your GP, they stick a blood pressure cuff on your arm, and you take a blood pressure. But less than half had their blood pressure tested. In terms of the cancer, now that's any cancer. We know breast cancer is the highest form of mortality in women, then lung cancer, pancreas, and a number of others. This doesn't discriminate. It just says, were you tested for any form of cancer in the past 12 months, yes or no? The fact that only 17% of women in the Nordics got tested for any form of cancer really speaks to the need to increase awareness, not only within women, but within GPs or the doctors that treat them. In terms of the diabetes, we know that that is an increasing prevalence. It's a disease that impacts women over time. We know that lifestyle factors has a large part to play in that. Again, awareness of those lifestyle factors, access to testing, awareness of why that's important. Awareness keeps coming up. How is it that we increase awareness? And then finally, 11% of women, only 11% of women, were tested for STIs or STDs. Now, HPV, we know the World Health Organization has a goal to eradicate cervical cancer by 2030. If this is the score in an environment like the Nordics, where this is freely available in all of the Nordic countries in various forms, how is it that we can reach that milestone? And that's a conversation we're having quite openly with those people that are driving the WHO program around cervical cancer. When we look at the preventative care, I just thought I'd break this out by the different countries within the Nordics. You can read the data that's on here yourselves. It does speak to the fact that we have these programs and there is some awareness, but it also gives us and the governments within the Nordics a very clear North Star. What can we do more around creating awareness, access and affordability for preventative care? Emotional health, I mentioned that this is a wave of ill health that is sweeping globally. Gallup in their World Poll have actually been studying this since 2008. They've got immense data sets on this from an enormous population of people globally. And what our questions adding to that is showing that now globally more people are suffering from negative emotions that are keeping them from activities of daily living than any time before. Probably understandable given the pandemic, but also something that really points us to the ability to invest. Health departments, finance departments across the Nordics take note. We need to invest in mental health and help people to understand that there is help, there is access that's out there. In terms of opinions of health and safety, one of the most startling pieces of information that I've come across now is a couple of years of presenting this data is that 1 in 3 women will suffer domestic violence at the hands of an intimate partner. The fact that that is so prevalent, and that in this survey, the majority of women are saying that they believe that domestic violence is a problem in their area, it speaks to another area where we can do more to help women and their health. Basic needs, the Nordics scored very, very high in this regard, and it's an absolute testament to the society that you've been able to create in all of these countries. The fact that you have good food, excellent shelter, even for those people who can't provide for themselves, whether they be from the countries themselves or immigrants, speaks to the equality and the society that you've built. And then finally, individual health. Pain is, as I've already mentioned, one of those things that is insidious. Women in particular suffer from pain, whether it be due to monthly cycles or whether it be to injury. But they suffer in silence, and that keeps them from engaging either in the workforce, which has a direct impact either on the economy of a country or on the activities. Women do billions of hours of unpaid work every day, which is not recognised. And if they're in pain, they may not be able to do that. That suffers then within the family unit, within their friends. So pain is one of those things that help us to be able to, or the pain score helps us to be able to target something which is largely unseen. And so this is my last slide. And the clock stopped at 10:32, so I'm actually not sure how long I've been talking for now. But I've mentioned these 3 words a number of times: awareness, access, and affordability. Awareness for women themselves, awareness for the women's partners and families, and awareness for governments and societies, organisations that help bring knowledge where it's needed to help then engagement. Access is about the woman being able to access the care that she's provided, the provision of those services in the first place, but provision in a place where she can access them. In some parts of the world, women will travel 4 hours one way just to get water. She's unlikely to travel 4 hours then to go and seek medical care. So the medical care needs to go to her, which speaks to many aspects of technology, handheld, battery-operated, satellite-powered, artificial intelligence to help us bridge that gap between where they are and where they need the care. And also then affordability, which speaks to the ability for governments to be able to fund, individuals to be able to see the need to invest in their own health. It's not just about the government helping us, it's about what we can do to help ourselves, and how we bring all 3 of those words, awareness, access, and affordability, together. And why it matters is because healthy women are the cornerstones of families, societies, economies, governments, and our globe. The healthier our women, the healthier our globe will be. So thank you very much for allowing me the opportunity to speak first today. I appreciate very much your attendance. Thank you to the speakers that are yet to come, and I hope you enjoy the rest of the program today.